The patient is a 66-year-old Caucasian male that presents to UTMC Recovery Services IOP for Suboxone follow-up. He's been on Suboxone for about 10 months with no adverse reactions noted. Prior to treatment, he was using approximately 1 gram of heroin daily via IV, and he used that for about 20 years. The problem started by abusing pain medications from a neck injury that was sustained nearly 30 years ago, and has progressed to abusing illicit drugs. The patient continues to make progress with his recovery. He continues to struggle with medical issues, but has improved with his compliance to substance use treatment and is making an effort to maintain his sobriety and improve his overall medical health. He has had cravings, but there's been no signs of withdrawal, which would suggest that he's not been using illicit drugs. The patient is at high risk for relapse, as evidenced by poor family relationship dynamics, a lack of structure to his normal day, and continued cravings. The patient also does not have one-to-one counseling services, but he does attend group IOP counseling sessions. Patient appears well-groomed, makes good eye contact. He's cooperative and engaged. There's a little bit of psychomotor agitation. He's got some tremors and a little bit of fidgeting. His speech is at a normal rate and normal volume. In regard to his gait, he's got a shuffling and unsteady gait, and uses a cane to get around with. Patient rates his mood as good, his affect is labile. His thought process is linear and goal-directed. His thought associations, there have been no loosening of associations. His thought content is normal. And also there's no perceptual abnormalities noted. He's alert and oriented times 4. And his insight is fair, as evidenced by seeking treatment for his substance use. Judgment is also fair. In regard to his cognition, he's cognitively intact to conversational testing with respect to attention, orientation, fund of knowledge, recent and remote memory, and language. In regard to his medical history, he's got adjustment disorder with mixed anxiety and depressed mood, cervical spondylosis, chronic pain, coronary atherosclerosis, diabetes type 2, disorder of nervous system due to diabetes type 2, GERD, generalized anxiety disorder, panic disorder, hyperlipidemia, insomnia, lower back pain, major depressive disorder that's recurrent and moderate, opioid dependence on agonist therapy, peripheral vascular disease, and tobacco dependence. In regard to goals for this patient, we would like him to remain 100% compliant with his medication maintenance while receiving MAT treatment. We hope that he will be able to identify and verbalize medication concerns. We're wanting urine specimens to come back negative for illicit drugs, but we do expect it to be positive for buprenorphine, because that's one of the ingredients in the Suboxone. We'd like for him to continue IOP participation. We will monitor for drug toxicity and medication clearance. He will follow up at UTMC Recovery Services in 1 week, and we're going to continue his current treatment regimen. In regard to that regimen, we're going to refill his Suboxone script, which is 8 milligrams as sublingual film, and he takes it twice a day, 1 in the morning and 1 in the evening. He's going to follow up with us with 1 week, or if the symptoms worsen or fail to improve. No new orders were placed at this time, and we made no medication changes.